And also, I want to tell everybody, Dr. Kanchan Sharma, she is the president of Ayurvedic Practitioner Association, well-known association in the UK, and she is the president of that one. And I thank you to her. I just in the very short time, she came and attended this webinar, and she is well-known Ayurveda practitioner here. Also, she worked for NHS, and she's doing great job. And I welcome her. And it's a very unique concept. This one is everybody is working in this country or Europe or any other country, European countries. Like before 2-3 programs you already done for the practice of outside medications. What we allow in India to use, other world not allow us to use that same medications. You work on that 1-2-3 program, thanks to you. That's very great. Now, today, Kanchan Sharma, because she know more legally what we allow, what we not allow, what we know, I know, we only can give the custom-made medications here. So many Ayurvedic medicines, especially Rasarsayan. In India, we allow all the European, England, America, Canada, other countries, they not allow us. And I don't think so many people take the notice. Why not? If other therapies, like I told 2-3 program before, if allopathy is not the Indian system designed, Indian system, Ayurveda is Indian system for the treatment of the look after of the health, Ayurveda, yoga, marma therapies, Shalyakriya. We know we are complete. Ayurveda is a complete system of the health, to give the health to all the world, all people in India, not 1 or 2 century, 1 or 2,000 pound, 1,000 years. Is yugo. In Treta, in Dwapar, in Kali Yuga, in Satyuga, everywhere was Ayurveda. It's still doing great job in India, same medications. If those medication, what we using in India, government already passed them, got to check very seriously, every pharmacy, they can't do anything rubbish there. They are very careful, like other health authorities in the world. They checking, and India also checking that one. They have the very good standard for those medications. Those medications not allowed in anywhere in Europe. This is the very unique, I think no one done program on this one. I talk here in the UK. Some conferences, they start that one. Last year in October, Dr. Bhamraji first time listened this idea, and they invite the allopathy, NHS, and Ayurveda doctors. We done the conference. After that one, next conference, Dr. Palitha also done. They invite the NHS allopathic doctors there. Third one, Dr. Suresh Swanpuri and Dr. Venkat Joshi in the 2nd or 3rd June, they also done. We are started that one to work with the NHS doctors. We discuss with them, but I think that's not enough. Just talk is good awareness. people can think that's one. But most important, Indian government should come forward and discuss with the whole world if their therapies, their system completely freely using in India, they not have the problem. India government, public don't have the problem. Public is also not problem here. All the Ayurveda practitioner here, so many practitioners, they're doing, but they can't do freely. They can't use all the Ayurvedic medicines, which one Ayurveda say, okay, in this kind of the disease, we have to use these things. Ayurveda practitioners tie their hands. They always say, oh, government not allow us. This should be talk in government to government. If the Indian government talk to other world government, they can give them this question. If India allow every therapy, doesn't matter. People get the relief from any problem, they use that. Otherwise, they can stop it. Indian medicines, I never seen the side effects. I'm doing Ayurveda from 50 years. Indian Ayurveda practitioners are very skilled here in UK. I met so many people. They know me very well. We know each other, but they are stuck. They can't use what Indian medication we use in India, what they learn. Ayurveda, all the MD, BAMS, PhD, what they learn in India. They done the degrees from there, and they learn those medication. Now they are struggling here. How can they make the new medications now? What they learn, they have to use it. This is very important subject, what you chosen today, and you listen, we starting on this one. This is, I think, great thing you're doing, Dr. Sharma. And in my point of view, India government, if they talk with the other foreign government where the Ayurveda people are there, then Ayurveda we can spread more. Ayurveda we can use freely. Every government, they say, no, we not allow. We not check this one. But if India checked that one, in India, government is using, all the hospital, all the Ayurveda practice is using, same thing they should allow on other countries. It's not mean they have to check again. They have to decide again. They don't know about the Indian herbs. So many years, they just know now the Haridra and the something Arjuna and something Ashwagandha, this thing, that thing. They just stuck there. India have everything. They had the researches. There's already those formulations are practicing from thousands years. And there people getting relief. Allopathy only came in India nearly 100 years ago. Before that one, no one knows that allopathy. And allopathy life is in 175 years, less than 200. Homeopathy is same. But India government should talk this one to others, explain to them, don't worry, we are checking every medication. Let us, our practitioner, which one from India is certified, qualified, let them use that one. We can help the world then. But every government, I can't say more than this one strong word. Why they not doing? Everybody know. We can't talk too much. But India government, if take the step forward, all the Ayurveda practitioners doing outside, they can't freely use their medications. So if you don't have the proper medication, how can you cure and give the relief to the chronic diseases? They not allow even come to the UK. We know that I'm the other researcher. I done so many years. I made the new formulation from the world things that I use on that way. But it's very difficult. I spent nearly 10, 15 years here. So what can I do? How can we control these things? We can do it, that one. And this is the other subject. For India government should have to talk them, should have to help the Ayurveda practitioner. Then a lot of Ayurveda practitioner also can come and work here. And a lot of pharmaceutical company who are making the Ayurveda medication, they also can get the benefit from that one. India government also get the good name for the Ayurveda. In my point of view, if we all work on that one, but in the, I know that our practitioners are so many, they are also stuck there. They just say, talk and don't come forward to say their words, say their views on that one. What they want, what I feel, I said, maybe lot of other practitioners, they have the more good brain. They can say more better than me. They can give the other ideas to India government. Your platform, thanks very much. No one even providing platform here. They don't want to come. I spread this one in the group. Everybody is there. They should come forward. And thanks to Kanchan Sharma, she straightway she come. She is very responsible lady, and she's for the APA. I think she's doing a great job. She come forward within half an hour, and we want to the views of what she thinking. In my point of view, if we want to Ayurveda spread in the whole world, like yoga is going everywhere, we have to give the good practitioners, good Indian medication, allow them. Yoga was easy, just exercise. Ayurveda is more forward, more difficult. No one can do the Ayurveda. Everybody can't touch that point, this one, because there's internal health problem. Ayurveda practitioner I met there, they have the brilliant knowledge. They know everything, but they are stuck in their hand. They are like send it to the for the army to fight with the enemy without any weapon. Our medication, our Ayurveda formulation, what we use in India, those are our weapon to fight with the diseases. But if we don't have, how can you think this one? No one can make making the new formulations not easy. Take a lot of time to study of those herbs. Whole Europe, whole world have the nature make their herbs in that area for the. I think God is always looked after the everywhere where the human anybody they living there. God give them that area for every medicine. How can they do the study again for a long time? They need big study, those things. And already which one they already use, they know, they have the confidence, they have the, they can use that one, then they give the more results, that one. So I think so, this is our problem for the whole world, I think so. And every country, India government should speak with that one. And I also request now to please Kanchan come and say forward. You are by law, you know more than me, okay? You study that one, and you know the lot of knowledge. Many times we sit and talk, okay? So Pawanji, allow Kanchan Sharma to introduce to our panel, and so she can say what is the good things over there. Thank you.
Thank you, Avtar sir, for introducing. Before your blessings, I have already written to her that please send your photo and details to me, so I can add your photo in this flyer also on YouTube. So please send me your photo and details, and we would like to have your communication also, your speech also. Welcome.
You want to I take the photo and send it to you?
No. Wonderful. No, thank you so much. I mean, he just forwarded the invite to me, I think 30 minutes ago, 3 o'clock. And luckily, I was not at work, so I could join. So it's a pleasure.
I know. Thank you very much.
Yeah. And I didn't know what was the topic, but by listening to you, Dr. Avtar, it is a need of the time, and we just need to work collaboratively. And I completely agree to that. The recognition Ayurveda has received in India as a parallel medicinal system, everywhere it has to be the same standard. It has to be accepted because we have so much potential, and it has been, say, thousands of years. Everybody is using it. So, what more evidence does people need for making it authoritative as a medicine, complementary system, even though? Um, so I completely agree with you. We need more dialogues. We need more dialogues with the right people, right agencies, like committees, probably, to steer this in the right direction. In the UK, we have been trying since 2000, precisely, if I remember, it was 2000. We had I think, consultations were started to build up to make Ayurveda under the complementary health system, traditional complementary health system, which is the TCM. And then come 2005, there was some movement, with the European. At that time, UK was under Brexit. Sorry, UK was within European um, countries, basically. And then Brexit happened. So just before the Brexit happened, I remember quite, because I joined 2006 the APA, and since then I know for a fact that APA has constantly wanted and working towards making Ayurveda as a statutory regulated, like, when we have statutory regulation, you can do a lot of things and standardize a lot of things. And that is one thing why UK is not probably accepting Ayurveda more on a wider scale, because the policies are not there, the register is not maintained, there is no standardization, and all these things needs a government approach. So I completely agree to Dr. Avtar saying that we need support from the government, Ministry of Ayush. We need those dialogues happening on a very higher level. Of course, the practitioners in the UK are doing their best within the available resources. They are wanting to practice authentic Ayurveda. So the government has a lot of restrictions. Now, we chose to live in this country, so we need to abide by the laws of the country. So that's one thing. We have to understand that not every country allows you, and there are societal norms and laws, basically. But not even having the support and legal status and not a regulated profession is something holding us back, definitely. So NHS, I work for NHS hospital, and NHS until so far, which is the National Health Services. So UK has this wonderful health system, basically, which has been working absolutely fine till now. And it is a government body. So every decision has to go by step. We understand that. It's not easy to get in on board, directly. Let's start prescribing Ayurvedic medication. We are looking at that in a couple of years' time, but the dialogues has to start now. This is the right time, because NHS has shared their 10 years, next 10 years vision. It is available in the public domain, which is usually based on prevention. Now, Ayurveda is based on prevention. Which other medicinal system is going to help the world, the holistic, whatever we name it, apart from Ayurveda? Before even conception, before giving birth, we have all this. Even we can modify genetic abnormalities as well with the Garbha Sanskaras. During 9 months, we can make sure, however, the fetus we want to have, or any unwanted desired effect, we can absolutely nullify those by having right diet and right lifestyle. From Balarog, we know how to prevent diseases by absolutely making sure the kapha, which is the kapha pradhanya during the bal time, like 0 to 20 years of age. So how the diet should be. So this is all based on prevention, isn't it? So we can help, we can absolutely go in with just the prevention, diet and lifestyle measures. Give us the patient, give us their history. We make sure they are sort of recognized as per their dosha, and we, alongside the modern medicine, we are not opposing any modern treatment. See, we are advancing, so our way of living is changing, and we are accepting the modern technologies. So we have to accept that in need of infection or so, we need antibiotics, we need surgeries, and that is helping us to our lifespan is increased in last couple of decades because of that. But where there is not needed, and where the lifestyle conditions can be reversed, we want us given the priority and we can help definitely. So diabetes type 2, blood pressure, cholesterol, arthritic, you name it, and there are so many. Management wise, the modern medicine just manages the symptoms. What we prescribe is the symptomatic relief, such as anti-inflammatory or analgesic, and life goes on for them for repeat prescriptions after repeat prescription for many, many years. There is no effort at that moment in that to reduce or even reverse the condition. That's where Ayurveda can focus. So there is a potential, there are willingness amongst the practitioners, there are movements happening in the UK, but what we are lacking consistently is support from the government of India. See, we can do so much on a local level, but if we are not having this policymakers joined together, we cannot progress. So definitely need more and more of these dialogues. um, so we are in limbo. There is no regulation, there is no laws in that sense for us. So what we as a Ayurveda practitioners refer to, and what I suggest to the new practitioners who join the APA as a new practitioner, is that look on the government websites. So when you, because all these more Ayurvedic medicines, you need to import them. Again, when we talk about import and suppliers, there is no standardization within India as well. We have multiple suppliers, but we do not know exactly where to source the authentic herbs from. Okay, unless you have a traditional Vaidya Gharanas and you are just, the second or third or fourth generation of Vaidyas, you know exactly where it is cultivated, where it is grown, and how to take responsibility of that. That's fine. But
You are
common
100%
practitioner,
right.
yeah, I mean, there is no resources. There is nothing where standardized government website. Here we go. There are these government suppliers, as supported by Ayush or anybody. I think this is started. If I remember, some work around this area has started. I think they are giving the Ayush trademark for some polyherbal formulas. I have not yet explored that, but it is a good, if it has started, that is amazing. That's going to be welcomed by so many practitioners like us who do not have direct contact with the direct suppliers. So first is standardization has to be there, because we use minerals, we use raw herbs, and many of practitioners don't even know the Latin names of the herbs. So how are we going to make sure this is the accurate one? So we recently, unfortunately, there was a case, and I do want to mention this on a social platform now, and it is that was very sad episode for the Ayurvedic professions couple 2 years ago, that a practitioner who diligently prescribed Guduchi, only Guduchi, to her patient. The practitioner was then absolutely sued by the authorities that the person had some complications, and unfortunately the person passed away whilst in receiving the treatment in the NHS hospital. The coroner's report stated and highly noted that the Ayurvedic herb Guduchi was to responsible for that death of that patient. That was a lot of risk to us practitioners. That obviously we then absolutely after that, as an APA practitioner, we decided to do a seminar workshop to retrain our practitioner and make sure that they are keeping all the notes, and they are making sure where the supplier is from, which medication and herbs they have received from, what is the expiry, what is the batch number, standardization, everything we are documenting it. But again, still there is a risk, because we do not have this list of standardized suppliers. Maybe that is the reason why UK is not willing to standardize, because it's a long task. First, maybe get Ayurveda as a complementary system in the NHS. That would be a ideal way to get in, because prevention, that's our forte. We can help the diet and lifestyle, we can help patients with that, and then simple herbs and spices, single herbal formula we can help with. But it is a long way. And we will definitely need a lot of support from government. Specifically, Ayush department is doing so amazing in some of the European countries. Like Germany is excelling. There are so many European countries. They are absolutely open heart. They are absolutely welcoming Ayurveda products. Why not UK? So yeah, that's what I want to say. Share my a little bit today.
No, you done very well, and I'm say this one. Yes, so many on the counter in the shops. What they selling now? They are not very much good standard. That you are absolutely right. And why I am making here everything? You seen, you visit my clinic, Dr. Sharma visit my. Why I am doing? I am 100%. Don't do anything cutting. Doesn't matter. People say why we can send you this one. I tell you one thing. Some products somebody say I bought that one. Cost me quite good money. I told them if somebody needs to give to them. I just use one. Other 10 products, I say no. Completely. We have to be. Ayurveda practitioner in the UK. Definitely we talk some other time. There are so many using the European herbs.
Yeah.
I using some other countries. I done a lot of work on that one. I study all the herbs that one. Where I try which one is very similar. We can't find from there. We can find from here. And one thing, when I learning in the Gurukul, my father was my guru. He say, always say, beta, make the medication which one everybody can eat. Taste should be like a enjoyable. So still now we have so many things like this one. Like you mentioned the Guruchi, many people Guruchi give the side effects if they take with the wrong kind of diet. So the practitioner should be careful. But sometimes this kind of happen, and maybe sometimes patient not follow the diet properly. It's not Ayurveda practitioner's fault. Guruchi is brilliant herb everybody use, but maybe patient not follow the proper instruction of with that one. So this one you done the great things, and I think anybody else have any question or somebody want to talk on that when the group for this one, we are I think welcome.
I have some question with Kanchanji, if you permit.
Sure, please.
From when you are there, madam?
In the UK?
Yes.
2006, January 2006.
After passing BMS from India?
From, Nagpur University in 2000. So I'm practicing for 24 plus years now.
Great. Madam, just a childish question. What is the difference and why we are not able to touch the patient body before any course there? Means whether our BAMS or MD courses are recognized to touch the patient's body, or we have to do some similar courses or short-term courses to touch the patient's body?
Oh no. So again, this is UK's social norms and professional boundaries more so. So we are very used to of when we go to see a doctor, the doctor will either check a pulse or put a stethoscope. This is a rare sight in the UK because of a lot of social structure. Basically, doesn't allow you to touch the patient directly. Obviously, if there is a need, such as we have to do pulse checking, without that, obviously, no Ayurvedic consultation will happen. So if you understand your professional boundary and establish the way to communicate with patient, you are absolutely fine. You just need to take their consent. Yeah. So in India, you don't really ask, may I? Here, you just have to make sure what the next step. You have to keep clear communication because most of the patient never been to Ayurveda practitioner. So when they see a GP here, which is the normal way of seeing a doctor, the GP has, I think 15 minutes the most to see the patient, and they just ask questions, and on the basis of they just prescribe you something. But touching a patient if needed is absolutely allowed. There is no degree required, such as be MD or anything. If you are a healthcare practitioner, any healthcare practitioner, for example, pharmacists, nurses, anybody, but you just have to maintain your professional boundary. You have to take the consent from the patient, and then it is allowed.
In America, in USA, generally our doctors have to admit in some short-term courses for massage therapy, acupuncture, or acupressure, whatever it may be, but which is allowed in their country. Then only they can touch the body of patient.
That could be potentially, if I understood American system, could be potentially due to the insurance provider. So in the UK, because the profession is not regulated, so there is no register for regulated professions here. Anybody can, if you have confidence, if you have knowledge, you can be Ayurveda practitioner here, as long as you have a proper insurance. Because and I do request everybody that make sure you have a proper insurance covered, because the world what we are in is absolutely, is not the world is basically going in a different direction. So if somebody is not happy with your service, they can sue you for anything. Simply just in a consultation, you haven't even prescribed anything, there are chances they might just say that something is wrong, and hence the insurance, professional insurance is must. Now UK, you can have a degree from Indian, any recognized university. You come to the UK. If you want to explore your knowledge, such as I have done Western herbalist course, I have done nutritionist course after coming here. I went back to Kerala to do advanced Panchakarma courses, but that just for me individually, I just wanted to have more information and knowledge around that area, which is not mandatory. If pure BMS, I can still register with Ayurvedic Professional Association as long as I have the correct insurance with me, and I can practice.
And insurance will allow it.
Yeah, so insurance will have a criteria that what is allowed, what is not allowed. So Ayurvedic professional website has a very detailed information on it. Who can be registered as Ayurvedic doctor? Who can be a therapist? Who can be Ayurvedic nutritionist? So depending on how many hours you have spent studying and what is your certification suggest, we then register those people under that particular criteria. Then the insurance company will provide you insurance against that criteria. For example, if you are Ayurveda therapist, you are not allowed to prescribe herbs or provide any herbal supplement, but you can give therapies such as all the Panchakarma therapies. So your insurance will be just for that.
Avtar sir.
No, she explained very well, and what she's saying that absolutely right. And here's as they say, they have to be very careful who doing the job, and when they checking, the people come to me, and also, but it's in this country, most of people are there appreciate very much for the Ayurveda. I have I most of my clients are white, okay, lot of, and they don't mind like this one. Even Indian people, when they come, when you give them, I think it's also depend on the Ayurveda practitioner. When Ayurveda practitioner is in Ayurveda, I think can mesmerize the patient if you tell them what is going on in your body. That is the best thing. If Ayurveda practitioners are quite good skill, they can check the pulse. No need to check anything area. Pulse, anybody can like a shake hand. 3 fingers, not the hand, palm, or just on the near the thumb. When Ayurveda practitioner telling the patient, oh, you have this problem, you have this problem, I seen the people's their eyes, they crying like this one. They appreciate that one. They respect that one. They telling about how you know. how you know what is going on in the body? This is only in the Ayurveda. There's no any therapy in the world who can check the pulse and tell the patient what's going on in your body. The people, Ayurveda practitioner, I'm not talking about myself. I have so many patients, they wrote about my check. But all the Ayurveda practitioners are skilled. And when we see the patient, we need the medication what in India we was using. If we use here, we can give them more good result. That is the only, at the moment, we have the problem. Otherwise, all the Ayurveda practitioner who do, I always say, who once they do the BAMS, he is the Ayurveda vet. And he know how to handle the patient. He know how can they use their skill. But if they don't have the medication, then they have to do the other study in the other country. They take very, very, very long time. So this is the only we at the moment in UK. I know so many Ayurveda practitioners. They're doing great job, and APA is helping them do a lot of seminar, webinar. They're doing this is the oldest, I think, the
professional organization and the largest
and oldest. And the people are doing, the people should also, I have one thing I say, all the other association also they should work together. But is the biggest problem, I know Dr. Ati, Godagama and other thing, we done so many meetings there, Dr. Suresh and everything. But it's from last 15 years, 20 years. First time I registered in 2002. That time was the Dr. Murthy, Dr. Atik, that when I registered as a practitioner. And they trying to come together, but I can't say so much big thing, but they don't want to come in one umbrella.
Everyone has been working for many years. And as I can say, I'm just watching. Now I am, as a AP president, I am seeing even more detailed view of everybody's actually. But everybody wanted one thing, and they still want the one thing, that statutory regulation, so that we can standardize Ayurvedic practitioners' practices. And that could open a new portal. As we know, UK landscape is shifting. Many people are absolutely wanting holistic answers now to their symptoms, whatever symptom they have. They want to reconnect with either food through nutrition to nature. People are attending so many yoga classes. You will see yoga everywhere, and it is accepted by NHS as well as a complementary treatment right now. But there are conversations about mental health, meditation. You can see bits and bobs everywhere. But still, Ayurveda is, even though it's gaining interest, it is still sitting outside of the mainstream. Okay, we haven't received the recognition as the within the healthcare what we deserve. And I understand too many incredible practitioners are working in silos right now in the UK. They're doing amazing job. We are doing all our efforts to bring them together. But then what? Unless there is a shift in the policy from government perspective, we're going to be still the same, practicing within our circle, doing what we are doing, trying to hold the authentic Ayurveda and treat the patient, wholeheartedly. I think there needs to be more now. A very steep climb has to happen, so that we need regulation, we need policy changes, and we need some government support to push this forward, definitely. And I think UK government is going to be a little bit inclined to accept not full extent of Ayurveda. We understand that there will be many years when the Ayurveda will be as a complementary or health under the healthcare as a complementary system. But some aspects of Ayurveda we are ready absolutely to take it to social prescribing, for that example, and taking health and nutrition in under the Ayurvedic care. So let's see.
Now I would like to request Dr. Dinesh Kumar Rai ji. Dr. Dinesh ji, pranam. Welcome, welcome. प्लीज अनम्यूट. आप म्यूट हैं, म्यूट. प्लीज अनम्यूट. यू आर म्यूट. ठीक. डॉक्टर निशांत शुक्ला जी. डॉक्टर निशांत शुक्ला, जामनगर से. Our next webinar is on Assistant Dog Day. डॉक्टर निशांत जी, दिनेश जी, क्या हुआ? दिनेश जी, आपका अनम्यूट नहीं हो रहा है, क्या हुआ? नहीं हो रहा? कोई बात नहीं. डॉक्टर निशांत शुक्ला जी. निशांत शुक्ला जी तक भी आवाज नहीं जा रही. तो फिर आपका ही आशीर्वाद लगे गुरुदेव. सर, एपीए हैज रिकॉग्निशन टू रिकॉग्नाइज.
Sorry, I didn't understand your question. Sorry.
Means your association has recognition to recognize the Ayurvedic doctors.
No, we are not accrediting body. We are membership organization. So whoever has the qualification, we provide them membership, we provide them support, and keep CPDs like continuous professional development. We support them, but we don't accredit any courses. We don't run any courses as such right now.
And registration?
Yeah, we do offer registration. Yes.
Registration of Ayurvedic doctors.
I'm not.
In India, every
Yeah.
Ayurvedic doctor has to be registered by the state council or state board.
Yeah. So no, that's not what we are. Because as I said, in the UK, it is not regulated. There is no professional body under government here.
And our counterparts, allopathic doctors?
Oh yeah, they have very robust system, General Medicinal Council, GMC. Even the pharmacist, even the pharmacy technicians have their register, which is reviewed, and they have to do certain hours of studies, and it is professional conduct has to be, under the standard. There is wonderful ways of keeping your professional people regulated, and that's what we want. Because see, what the trouble is, as you probably are facing in India as well, this holistic nutrition Ayurveda providers, on Instagram and YouTube, there is a huge surge of self claimed doctors. They do certain small courses, either they do it or not, we don't know. And they can start their own practice in the UK because this is not regulated. Anybody can claim anything. That's affecting the genuine Ayurvedic practitioners in the UK. I have done maybe 7, 8 years of studies, or being a MD, 11 years of studies. And I am doing a very traditional Ayurvedic practice, which is restricted by a lot of laws and regulation because I can't use multi herbal formulas safely or mineral based formulas safely. But these new generation of Instagram revived Ayurveda practitioners, they can just suggest you diet and nutrition advice, and they can still run the parallel practice. And that's where the APA's main worry is. That hence what we did last couple of years, a huge work has gone into segregating those, tiering them. That okay, if you're BMSMD, you are practitioner A. If you have the BSc in Ayurveda, then you are under category B. If you have done therapist course only, you are under category C. So for the safeguarding of public, at least, we have done that if the person wants to search a therapist, they know exactly where to look for. If they want to know a doctor, they know where to look for. So API has done amazing, I believe, at least within the capacity we have to regulate a little bit. But yeah, that's the reality in the UK right now.
Oh, no. So now Nichanji is here. Dr. Nichan Chuklaji, am I audible?
Hariom, namaskar.
Namaskar, namaskar. Your remarks.
Hariom,
Hari Om.
related to this topic, first of all, regulatory bodies are required, and especially practicing in foreign
Your voice is not coming, doctor. Now, okay.
Am I audible?
Yes, yes.
Okay. So, first of all, this up to this one, we have discussed about how to practice Ayurveda in UK, and what I got is uh, how we can propagate Ayurveda in its real sense. For that one, I would like to recite the shlok from Charak Samhita. It is very much applicable in the present day context. Today, the present medicinal practice is based on material, that is the dravya. But when we speak of Ayurveda, it is not only the dravya which is important. Say, for example, for decreasing the temperature, paracetamol is to be used. For treatment of a specific microbe, a specific antimicrobial is required, and like that one. But when it comes to Ayurveda, it is applicable everywhere, and the objective of the treatment is the individualized protocol to have the specific objectives. We need to define the objective first, and yukti syat yojanaha. Yukti is always important when we speak of the Ayurveda treatment. The yukti shabd is used, which describes that this can be done. What are the objectives? First, we need to focus on those objectives, and then we must select the specific medicine. Sir has highlighted one thing, that we can't use uh, metallic preparations in other countries except India or Indian subcontinent. In those countries, we have got the medicinal herbs for specific purpose. For instance, we used to have from shad chikitsa, we need to have two or three, combination of two or three, then we can add and subtract some of the medicines and make the formulation accordingly, which may be from the herbal or plant based origin. And in this way, we can definitely help in treating the problems. The chemical derived medicines is having the limitation. Today we are more concerned about the antimicrobial resistance, but I was reading one article, and the anti-cancerous medicine is having also developing resistance. Similarly, it is with the case with the metabolic disorders, where the medicines are becoming resistant, and the effect on the desired effect is not observed in treating such metabolic disorders. So the time is coming when the microbial drug resistancy would be the area of concern, and the Ayurveda is the only way. By the individualized practice, we need to focus on that one. This is the essence of Ayurveda. And before I end up, I would like to recite one the shloka, Samanyam cha Vishesham cha Gran Dravyani Karma cha. So it is what we need to find it out, the Samanya and Vishesha, what permutation and combination we would make it to have the desired effect on recovery. So with these words, I conclude my opinion. Thank you very much, sir, for giving me a chance to speak on one of the most important and vital issue of developing Ayurveda in countries other than India.
Thank you very much, Nishanji. Thank you very much. We will be meeting again on क्लोब्स सिंड्रोम। सर आज एक नए विषय पर वेबिनार रखी है अवतार सर, क्लोब सिंड्रोम। उसका नाम ही है क्लोब सिंड्रोम, जेनेटिक डिसऑर्डर है। उस पर 10 बजे से वेबिनार रखी है। और अभी जो इसके बाद वाली वेबिनार है, जो हम लोगों को बुढ़ापे में सबको जरूरत होगी, असिस्टेंस डॉग। आजकल कुत्ते आदमियों से ज्यादा समझदार हो गए हैं और वो आदमियों की ज्यादा बेटर देखभाल करते हैं। अवतार सर हंस रहे, प्लीज अनम्यूट। आपका ओपिनियन चाहता हूं। म्यूट है, आप म्यूट है।
इसका मतलब आप कलकत्ता में नहीं है।
भोपाल हूं सर।
इसलिए बोल रहे हैं।
घर नहीं हूं मैं।
नहीं भाई, क्या बात है, इसलिए बोल रहे हैं। ये आजकल बहुत फास्ट फॉरवर्ड है टेक्नोलॉजी। ओके, अगर ये आपकी आवाज कलकत्ता तक पहुंच गई तो फिर देख लो क्या होगा।
नहीं, लेकिन सर एक वाकई में एक कैटेगरी चल गई है, उनकी ट्रेनिंग का सिस्टम है जो
एक
अभी।
बात कहूं आपको,
हाँ
छोटी सी बात कहूंगा, अगर लोग
हाँ।
समझ जाएं तो।
हम्म।
आप खुद में जीना सीख लो।
कुत्ते नहीं लगेंगे।
नहीं, अगर आपने ये जो बात कही है, ये आपका सोच नहीं है। जहां यहाँ इस वक्त जो आप जैसे बुजुर्ग हैं, उनकी 60-70% लोगों की ये प्रॉब्लम है। तो मैं उनको ये बात कहता हूँ, और बहुत से लोगों ने फॉलो किया उसको, और वो कहते यार ये हमें पहले क्यों नहीं पता चला। हमारे में कहते हैं, आप जितनी किसी की पकड़ बनाकर रखोगे उतना वो आपको तंग करेगा, वो खींचेगा आपको, उसके ऊपर टाइम देना पड़ेगा, जान लगानी पड़ेगी। छोड़ दो। मैंने आपको शायद नहीं सुनाया था, मैंने एक छोटी सी रुबाई लिखी थी उसके लिए, 2 लाइनें। मैंने कहा, है पंजाबी में है, आप समझ जाएंगे। हर पंछी नू अपनी भरन उड़ान दे, हर पंछी नू अपनी भरन उड़ान दे, जेड़ा छड्ड के जांदा है ओनू जान दे। रिश्ते किधरे पत्थर ना हो जावन तेरे, रिश्ते किधरे पत्थर ना हो जावन तेरे, पत्थर दोस्त दुश्मन नहीं पहचानते। रिश्तों को पत्थर बनने से पहले ही खुला छोड़ दो। अगर आपका होगा आपके पास आ जाएगा, नहीं तो खुद में जीना सीखो। आयुर्वेद यही तो सिखा दिया। आयुर्वेद का क्या मतलब है? आयुर्वेद के ऋषि मुनि हैं जो वो कितनी उम्र तक जीते हैं। हम
नहीं
किसी की
सर,
उम्मीद
सर
मत
सर
रखो।
सर आप गलत समझ गए। असिस्टेंस डॉग वो डॉग है जो हाथ पांव चलना जब बंद हो जाते हैं ना, और परिवार भी नहीं रहता पास में, तब सहायता करता है। वो
मैं
कैटेगरी
मैं
नहीं निकली।
मैं उसी की बात कह रहा हूं पंडित जी। आप अपनी सेहत को अपने गार्डियन खुद बन जाओ, आपको 99% कोई प्रॉब्लम नहीं आएगी। ये मेरी बात लिख लीजिए।
नहीं, प्रॉब्लम आ गई तो की बात है सर, आई गई समझ लो। क्या कर लेंगे हम लोग।
अभी आप पंगे भी बहुत लेते हो ना।
इसीलिए तो बोला
आप
था।
जितना जितना आपकी अपनी बॉडी आपकी हेल्प कर सकती है, कोई हेल्प नहीं कर सकता
नहीं
अपनी
नहीं, ये
बॉडी
जो
को।
जब हाथ
आप
पांव चलना बंद हो जाते हैं ना सर, तब इनकी कुत्तों की हेल्प लगती है।
तो फिर कोई ना कोई कुत्ता साथ में रखा करो।
वो कुत्ते पर्टिकुलरली ट्रेंड कुत्ते हैं। वो ये
अब वो
नॉर्मल कुत्ता पालने वाले कुत्ते नहीं है।
अब फिर इंडिया को ऐसी यूनिवर्सिटी बनानी चाहिए जहां कुत्तों को भी सिखाया जाए।
है ना सर, है।
बस वे उनके ऊपर और ध्यान दो। पर मैं तो एक बात जानता हूं, वो कुत्ते भी कई दफा खराब करने लग जाते हैं, हमें पता है। हम जितना आप अपने ऊपर भरोसा करोगे, अपने आप को रेडी करोगे, अभी एक डेथ हुई है बहुत बड़े 115 साल का एक मैराथन रनर बाबा फौजा सिंह के नाम से, एक्सीडेंट से उनकी डेथ हुई।
हाँ सर।
अभी भी वो 15-20 माइल रोज चलते थे।
हाँ
और ये बात उन्होंने प्रूव किया। मैंने उसकी हिस्ट्री अगर 2 मिनट हो तो बता देता हूं।
बताइए।
उनकी फैमिली का उसने मेरे को बताया, क्या इंस्पायरिंग स्टोरी है। 80 साल की उम्र तक उनको अस्थमा था, वो चल नहीं सकते थे अच्छी तरह। किसी ने बोला नेचुरल डाइट ये लो वो लो करने के बाद और चला करो। चलते 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 उनको किसी ने पार्क में देखा, किसी कोच ने, कि ये तो बड़ा अच्छा स्टेप ले रहा है। उसने उनको इंस्पायर किया कि मैं तेरे को कोचिंग करता हूं। उसके बाद वो वर्ल्ड की मैराथन में जाने लगे। तो इससे क्या मिलता है, हमारे ऋषि मुनि 150-150 साल तक जिंदा रहे, अपना सारा कुछ करते थे, और इतने बड़े भीष्म पितामह जैसे 80-90 साल की उम्र में भी इतना बड़ा युद्ध लड़ा। तो हम उनको फॉलो करो, कुत्तों के ऊपर भरोसा मत रखो। कुत्तों को का भरोसा जो आदमी को कुत्ता बनाकर छोड़ता है।
सर उस समय आदमी भी काम नहीं आता ना सर, उस
नहीं,
समय।
आदमी की बात ही नहीं करता, मैं तो खुद की बात करता हूँ। आप
अरे
जितने
अपाहिज
अपने
अपाहिज हो गया, उनकी बात चल रही है सर।
और अपाहज को भी ठीक किया जा सकता है। आयुर्वेद के पास आ जाइए, मेरे से मिला दीजिए। ओके, 80% तो मैं गारंटी देता हूं बिना देखे, 80% गारंटी देता हूं। बाकी भगवान जानता है। हमने वो केस जहां चलने लगा दिए जो 4 कदम नहीं चल सकते। आपने मेरा क्लिनिक देखा है, फ्रंट से गाड़ी पार्क करके 15 मिनट में जो यहाँ पहुंचे थे, आप 5-5, 6-6 किलोमीटर चलते हैं। वो
ठीक बोले आप।
कितनी देर है, कम से कम 30-40 मीटर का दूरी है जहां से कार पार्क होती है। वो लोगों ने खुद कहा, अपने लोग बहुत से हुए, उन्होंने कभी किसी को फीडबैक नहीं दिया। मगर जो यहाँ के लोग यूरोपियन और यहाँ के, जब उनको किया, उन्होंने फीडबैक दिया। अपने लोग तो उससे शर्म मानते हैं, कोई क्या कहेगा। मैं कह, कोई कुछ नहीं कहेगा, तुम ठीक रहो, इतना बड़ी बात है। अच्छे अच्छे लोग मैं बात करता हूँ, अगर वो अगर अपने अपनी फीडबैक देते तो मेरे को तो उन्होंने कहा आपके पास तो लाइनें लग जाएंगी फिर अगर हम फीडबैक देते, जिनके 5-5 हजार फॉलोअर हैं।
हाँ
तो हमारे लोगों की ये मेंटेलिटी जो है, उसको क्या करोगे आप। मैं सही बात करता हूं, इसके ऊपर वेबिनार रखिए, मैं उसके ऊपर बताऊंगा कि क्या क्या कैसे करना है। मैं, भगवान ने उतनी जिंदगी देनी जितनी आपको दी है, उसके बिना हम, पर मैं चाहता हूं कि कोई भी इंसान दुनिया का, नॉट ओनली माई इंडियन जो मेरे लोग हैं, कि वो बीमारी से ना मरे। मेरा और कोई एम नहीं है। जो मैं कर रहा हूं, और
हाँ
5-7 साल के बाद मेरी रिटायरमेंट हो जाएगी, अगर मेरी एज भी आ जाएगी रिटायरमेंट की,
जी सर।
तो उसके बाद मेरा मेरा मिशन ये है। मैं किसी को ये नहीं कहता कि ये, ना ही मैं गलत कहता हूं, जो प्रूफ है वही कहता हूं। वो प्रूफ हमें मिला, अगर अपने लोग सभी काम करने लग जाएं आयुर्वेद के ऊपर, ऑल द प्रैक्टिशनर, ऑल द पेशेंट्स। यहाँ ऐसे पेशेंट है, लोग क्या कहेंगे, अरे भाई तू मर रहा था, अभी तू चलने लगा, तो किसी और को नहीं चाहता कि वो चलने लगे। ये हमारे लोगों की बहुत की मेंटेलिटी यहाँ की है। आयुर्वेद वालों की भी प्रॉब्लम है। आयुर्वेद वाले नाराज इस बात से होते हैं मेरे से कि मैं उनको फॉर्मुलेशन नहीं, मैं क्या भाई, मैं फॉर्मुलेशन नहीं यूज करता।
हाँ
मैं तो हर, जो आयुर्वेद का सिद्धांत है हमारा, जैसे
हाँ
कंचन जी ने कहा, आयुर्वेद का आपको पता है सिद्धांत क्या है, आयुर्वेद के सिद्धांत पर ही चलते जाओ।
जी।
आयुर्वेद के सिद्धांत पर चलने से मैं कहीं कहता हूं, जो भी लोगों को प्रॉब्लम है, सब ने सब कुछ आपने सीखा हुआ है, मगर आप क्या लेजी हैं। आप चाहते हैं कि बनी बनाई हमें कोई चीज दे। वो एक कहावत है कि वो कहते हैं कि या रब हमें अनाज मत देना। वो
जी।
कहने का खाना भूख बके थे, कहना क्यों मनी ऐसे, कहना माँ जो है हमारी लकड़ियां लेने भेजेगी
हाँ
रोटी बनाने के लिए। आपके पास आयुर्वेदा है, मैं आयुर्वेद प्रैक्टिशनरों को भी आज बोलूंगा, आयुर्वेद आपके पास है, मगर इसका खुद खाना बनाकर, खुद बनाकर करना सीखो।
हाँ
आपको फार्मास्यूटिकल जो घटिया फार्मास्यूटिकल बहुत है, 80% है मैं कहूंगा। तो
जी
मेरे को कोई इसमें शर्म नहीं है। जो अच्छी चीजें नहीं बनाती, जो अच्छी है उनको देखो, नहीं तो छोड़ दो उनको, वो खुद ही बनाने लगे, किधर बंद हो जाएंगे। हम
हाँ
चला रहे हैं उनको,
हाँ
उनको हमारे लोग जो है वही चला रहे हैं।
जी
एक देता है 2,000 रुपए की, एक देता है 200 रुपए की, वही चीज नाम लिखा हुआ है। नाम को मत यूज करो, काम देखो, आप खुद बनाओ, बनाना सीखो। अगर आयुर्वेदा करना है, आयुर्वेदा का दूसरा कोई ऑप्शन नहीं है। अपनी हर्ब्स को ढूंढो, फ्रेश लो, बनाओ। अगर आपने आयुर्वेदा करना है, अगर आपने ऐसे ऐसे शो ऑफ करना है कि मैं ये हूं वो हूं,